A non-governmental organization in Akwa Ibom State, Milestone Initiative for Human Rights and Empowerment is leading discussions on how to reduce stigma associated with safe termination of pregnancy, STOP, and maternal mortality rate in the state. The stigma, according to the organization, is deeply rooted in cultural, religious, social norms and drives the rate of maternal mortality in the state. STOP guidelines are conditions necessary for safe abortion to be carried out within the law. The executive director of Milestone Initiative, Uduak Nyatak, made the assertion during a media training on STOP guidelines and right-based reporting on the RAISE project in Uyo, sponsored by IPAS Nigeria Health Foundation. She observed that women and girls, despite the adoption of STOP guidelines in Akwa Ibom, have been discouraged from accessing essential sexual and reproductive health services in form of safe abortion and post-abortion care due to stigma. Nyatak, while emphasizing that abortion remained illegal in Nigeria, said the window provided in the STOP guidelines should be accessed when necessary without discrimination or fear of stigmatization, even as she noted that the guidelines should cover unwanted pregnancies resulting from rape and incest. Survivors of sexual and gender-based violence often remain silent, unable to seek justice or support because of shame, misinformation and weak community accountability. This drives them into having unsafe abortions, which we are discouraging. The high rate of unsafe abortion in Nigeria is a big contributory factor to maternal mortality. We are talking about those that have become victims of abortion through gender-based violence, not those who willingly got pregnant. Those victims should not be traumatized further in the communities, she observed. Speaking on reporting on women's sexual and reproductive health for impact, Okpos and Thompson urged the media to write impactful reports, especially on reproductive health, using accurate data and demographic survey of root cause of sexual violations. He noted that such reports would not only reduce unsafe abortion practices but will reduce maternal mortality rate, which, according to him, is increasing in the country. On his part, Emmanuel Akpenet stated that the media have a big role to play in ending sexual violence, urging them to educate the public on the implications of sexual violence as well as giving the STOP guidelines a wider coverage. While observing that criminalization of abortion in Nigeria was the major factor driving people to unsafe abortion, Akpenet urged the media to also educate the public on the existing laws that protect the rights of victims of sexual violence.